Good morning or good afternoon. It's 1 o'clock. I'm Terry Scoggin, the Chief Executive Officer of Titus Regional Medical Center in Mount Pleasant, Texas. And this is our weekly community update. Wanted to say we're a little hectic today and a lot of things going on. So it's been a big week at Titus. I'm excited about the change that's coming. And over the next few minutes, it's going to be a short one today, but I just want to show you what's happening within our health system over this week, what's going to happen this weekend, and what's going to happen next week. But if you know me, I can't do an update and not talk about football. Had the opportunity to listen to Carrie and Daryl last week on the radio and listen to our Tigers have a good game. I thought they were going to pull it out at the end. They played better. Thought they were the better team last Friday night, but they lost. And heart went out to them and the kids on the night before Halloween. But it was fun to listen to my friends on the radio and give the play-by-play while I was doing my honeydew projects for Angela at the house. But want to wish them tonight good luck as the Mount Pleasant Tigers take the field tonight against the Nacogdoches team. The JV team won last night. We got a good report this morning. But good luck to Coach Pinkert and the Tigers. Wish them the best tonight as they're having a good season. The record's not doing some of the things that they're doing on the field, but it's exciting to see Mount Pleasant Tiger football hit the levels that we're hitting and where we're going to go when you start looking at the younger teams, 7th grade, 8th grade, freshman and junior varsity. It's going to be a fun next few years in Mount Pleasant, Texas, and at the high school for Coach Pink and the Tigers. So good luck to them. So what's got us all just jazzed up around here is this weekend. We will be going through an update or an upgrade of our electronic medical record, or our EMR. We currently use Epic. Epic is the gold standard of healthcare medical records in the world. We're the only rural independent hospital in the state of Texas who has access to Epic. And through an alliance that we had with LSU Shreveport, we were able to do this a few years ago and upgrade and use Epic, and it was great for our doctors, for our clinical staff, and for our patients to have access to some great technology. Well, through a new alliance that we signed with Ochsner, Ochsner is located and based out of New Orleans, Louisiana, and handles the majority of the market share in the New Orleans area, Louisiana, Mississippi. Through an alliance with them, we were able to upgrade our current Epic to their version. They have one of the top Epic instances or technology instances in the United States. They work closely with the Epic system in Wisconsin and do some things that are just cutting edge. So we're going to have access to that starting Sunday about 2 o'clock a.m. So this past couple weeks, our doctors, our team have been going through a ton of training, a ton of just getting ready and all the steps behind the scene. And over the next few days, you'll see a lot of visitors here from Louisiana who are going to have the first chance to come see our campus, to come see Texas. We're going to try and do it right. I've got Daryl and the team to cook chili for them on Wednesday, and we're going to cook pancakes with Brad Burrows and Robbie Hampton on Friday for the people from Louisiana, just to show them how Texas people can do it right. I want to thank my marketing team and shout out to Bobby Moore. This weekly update that we do is fun. I love the opportunity to talk to the community, talk to our team members, and show and what Bobby and Seth and Tracy have done with our room and different things. But Bobby designed this, and we have a T-shirt that we're going to wear next week. And but his T-shirt he has that all of our team members are going to get. But that's impressive. So, the talent that we have here and just the things that are going on, that's what gets me excited. We can do stuff like this and have a little fun while we have a lot of stress. And this is where I need your help. Next week's going to be stressful. So when you come in Monday morning for your surgery or for your doctor's appointment, wait maybe a little bit longer, maybe a few more things that we ask you to sign to get you into the system. So I ask for your patience. I ask for just take a deep breath. We're going to have team members in all the clinics, all throughout the hospital, helping patients, helping get information, trying to get your people signed up to MyChart. And our theme that you're going to see over the next few days is MyChart Reimagined. You'll see it on our T-shirts. You're going to see it on the banners behind me. You're going to see it on the side of our building. They'll be putting up a banner on the side of the hospital tomorrow talking about MyChart. MyChart is your ability to access your medical record. A lot of laws are changing and a lot of things are happening so we need to be more transparent and give access to more people so you can see your medical record and have access to your information. MyChart's going to allow us to do it. It's going to allow you to schedule appointments. It's going to allow you to do prescriptions or medication. It's going to allow you to talk to your clinicians. Allow us to talk back to you and say what tests you need to get done and how we can help you. This is a big win. It'll also allow us to do apps, and there'll be wearables. A lot of people have different types of watches or wearables at home. Our apps over the next few years will allow us to do that and you to put your whole healthcare together. So it is MyChart reimagined, but it's going to create healthier tomorrows. This is something very few rural communities will have access to, and we're excited about what this is going to bring. Here's how it's going to affect you. If you're a current MyChart user, on Sunday when you log in, it's going to be blank, potentially. We are working to get things added into there, and as you have an appointment, and when you see your doctor, your medicines will start to flow. The information will start to flow. But it's only going to start from November 8th forward. So over the next few days, if you have MyChart today, I encourage you to go to your MyChart, look at your email messages, and follow the steps to download your previous information. This will allow you to have it on your computer, to have it at home, or print it out. I'm doing it with my mom. I'm doing it for my dad, for myself and my family. I'm saving our information down as well. But if you do that this weekend before we go live, it'll be a good first step for you to have that information. Then as we go live on Sunday, you'll be able to log in with your existing user ID, existing information. You'll go into the current website. You'll go straight in and you'll see your chart. And we'll start updating that information. You'll be able to look at what they have in the system and start updating your stuff and moving forward. So we are going to take a step back in order to take a leap forward. So I encourage you to be patient through this process. But what we're going to be able to do with MyChart and the ability and the population health that we'll be able to do through this is going to be huge. I would encourage all the people who listen to see the updates. MyChart will be both in English and the opportunity to do it in Spanish. So whatever you or your family members are comfortable with, you'll have both those options. So we're excited about it. We're excited what it's going to do for our health system. We're excited about just the whole process that we've done. Triton is the name. It's the logo. We're transforming the health. And you're going to see that Triton logo all throughout our health system next week. When you come into the hospital or you talk to somebody at the health system, just give them a word of encouragement. Just tell them thank you. It's going to be exciting to see what this process and project's going to be doing. And I just want to thank everybody. Thank our doctors. Thank our board of directors for supporting this. I want to thank all of our team members for the hours they've put in up to now to get us ready for tonight. They will start tonight. It starts around 7 o'clock tonight of entering in data. So we'll have nurses on site all day tomorrow entering information. The clinics will have registrars and MAs and RNs putting information in all weekend. And then at midnight tomorrow night, they're going to flip the switch and we'll start a new realm at Titus Regional Medical Center in Mount Pleasant, Texas, and we're excited about it. So thank you for this opportunity. We'll look forward to see what's going to happen. From a COVID-19 standpoint, I just want to encourage you all to wear your mask. When I'm around town, I know people are frustrated, and a lot of people I've talked to this week and different things, and with the election this week and with just COVID itself and media, I would encourage you to still, what we've been saying since March of this year, wear your mask, wash your hands, and social distance. I've been sending out emails to our team members all week, reminding our team members that, the numbers are still increasing in Texas. We're still increasing as far as this community. We have 9 on the hospital this morning with COVID. One point during the week we're at 12, and last week we hit some 9s and 10s and 11s. So we're seeing numbers that have been the highest we've seen since July. So I would encourage you that we don't know who it's going to impact. We don't know who's going to get sicker than somebody else. So social distance, wash your hands, and wear your mask at all times. Anytime within a few feet of somebody, make sure you have that mask on when you're inside, that you can not only protect yourself, but protect them. This is the appropriate thing to do. This is being just a good citizen and just being a good person. So I would encourage you to focus on that, and we need your help. We're still trying to mitigate the spread, flatten the curve. As we go into flu season, we're seeing those increases in the ER. We're seeing the increases on the floors. So I encourage you to focus on how you can help yourself, your family, and your friends. Again, it's going to be a big weekend at Titus, and we're excited about the steps, and we're going to face obstacles this weekend, and I know the good Lord above is going to bless not only this health system, but he's going to bless this community and this country as well. Keep the faith. Thank you for your support of Titus Regional Medical Center, and God bless.